Preparing for surgery. Surgery will be performed at Cruz Plastic Surgery, located at 2081 San Joaquin Hills Road, Newport Beach, California, 92660. Things to avoid 2 weeks prior. Please discontinue smoking, nicotine products, alcohol, and blood thinners, such as aspirin, Motrin, Advil, ibuprofen, fish oils or omega-3s, vitamin E, or any of the following medications 2 weeks prior to surgery. Consents. Consent forms will be sent to your email. You may fill them out online or bring the physical signed copies with you the day of surgery. Prescriptions. Most patients opt to have their medications delivered to Cruz Plastic Surgery. Our contracted pharmacy offers lower cash rates for patients paying out of pocket. Their cash rate is around $114. They also accept all insurances except Kaiser. If you choose this option, please make sure to contact Newport Coast Pharmacy with insurance and payment information to ensure medications are delivered on time. Call 949-719-3707. If you prefer to have your medications sent to a pharmacy of your choice, please provide pharmacy information to your patient care coordinator. Remember to bring your medications to surgery if you did not get them delivered. Payment. Payment is due 1 week prior to surgery. If you are paying by check, payment must be mailed in at least 2 weeks prior to surgery. Transportation. All patients must arrange for transportation to and from surgery. Most patients will be in the office for 3 to 5 hours total. Please notify your coordinator in advance if you plan to use Uber, Lyft, or Yellow Cab. The day of surgery. What to bring. If you did not sign your consents online, please bring your signed consents with you and turn them in to the front desk when you arrive. What to wear. Wear a button-up or zip-up top, warm socks, and slip-on shoes. Dress comfortable and wear dark-colored clothing. Remove all jewelry and body piercings the day of the surgery. This includes wedding bands. If you have a piece of jewelry you are unable to remove, please notify the nurse when you are brought back for surgery. Showering, shaving. You may shower the night before surgery. Make sure to shave the surgical area 1 to 2 days prior. Mild stubble is okay. Eating before surgery. It's okay to eat a light meal prior to your surgery. Please limit fluids intake as much as possible 2 hours prior to surgery. Pre-op bag, folder. When you arrive to surgery, you'll be given a black folder with the following documents inside. Instructions on how to access your photos via your online patient portal. This will give you access to all pre-op and post-op photos in addition to any photos of tissue removal. Local discharge sheet. This will be located on the top of your paperwork in your black folder. This form provides instructions to follow immediately after your surgery. This includes what medications to take that night, eating immediately after surgery, compression and wound care, etc. You will also see your appointment time for bandage removal the day after your procedure. After-hours emergency line. A member of our staff will carry an after-hours emergency line in case any urgent medical issues arise outside of normal business hours. For all standard recovery questions, please wait until normal business hours, as this number is intended for urgent issues only. Medications. We prescribe a total of 4 medications: Keflex, Celebrex, Xanax, Norco. Please notify your patient care coordinator if you have any drug allergies prior to your procedure. Appointment sheet. This sheet provides all your pre-scheduled appointments so you can plan your schedule accordingly. If you cannot physically make an appointment, We will require you to submit photos so we can ensure you are healing within normal limits. You will have 2 drains that are removed at day 6. Most patients choose to remove them from home. We will send out a video tutorial 2 days prior. If you prefer to come into the office, please notify the staff and we will switch it to an in-office visit. Pre-op recovery items. We'll give you your pre-op bag upon arrival to surgery and a sheet in your black folder explaining what each item in the bag is for. This is essentially a first aid kit. There are certain items, like scarless, that you will not use until 3 months post-op. Each appointment, a member of our staff will instruct you when to start using certain items found in your bag. You do not need to bring this bag with you to any appointments.